what motivated you to pursue endodontics rather than other dental professionals?
Endodontics was growing very fast. When I say it's growing very fast, what I mean is,
Can you give us some insights into your educational journey and the steps you took to become an endodontist?
from my childhood, I was little interested towards dentistry. Then my brother joined in Saveetha in 1990.
You prioritize comfort and anxiety management during endodontic procedures?
Most of the biggest problem we have in dentistry is the syringe needle.
True.
So to comfort that, we give.
Hello everyone, my name is Vishaka and I'm thrilled to welcome you to today's interview. Today, we have the honor of delving into the remarkable experiences and journey of a distinguished professional, Dr. Sridhar Reddy sir. Dr. Reddy sir stands as one of the leading dentists in Pugatuttu, Nellore, with a profound expertise in MDS conservative dentistry and endodontics. With an illustrious career spanning 20 years, Dr. Reddy sir has tirelessly served patients and has left a lasting impact on their oral health and well-being. So, join us as we embark on this captivating exploration of Dr. Sridhar Reddy sir's expertise, insights and invaluable contribution to the field of dentistry.
Hi.
Hi sir. My first question for you would be, what motivated you to pursue endodontics rather than other dental professionals?
During my house surgery or throughout my BDS, I was in dilemma whether to go for prosto or endo. But that was the time, I am telling you, sometime about 25 years back, endodontics was growing very fast. When I say it's growing very fast, what I mean is, before that, why do you think any patient would come to a dentist?
For pain?
Yes.
For pain.
Yes, right?
Yes.
So, who can relieve the pain best? An endodontist.
Endodontist.
So, when somebody relieves your pain, what do you see them as? You see them as God, right?
Yes.
So,
Completely.
endodontics is one branch where any patient comes with pain, you can for 100% relieve the pain. Before that, it was extraction of tooth.
Yes.
You can't call that relieving the pain, right?
Yes.
So that really motivated me, and I started working on endodontics, and I joined endodontics in Saveetha.
Wow. Thanks.
You like that?
Yes.
Yeah.
So my next question for you would be, can you give us some insights into your educational journey and the steps you took to become an endodontist?
My dad is a dentist.
Oh.
Yeah, he is practicing past 1972, and from my childhood, I was little interested towards dentistry. Then my brother joined in Saveetha in 1990. So my elder brother.
Okay.
So that time I came here, as I listened to his stories, I was more motivated to join dentistry. Then I joined dentistry BDS in 1994.
Okay.
Later on, I did my PG also here only from 2000 to 2003 in Saveetha itself.
Okay.
And
from then on?
I went back home. I was there in my dad's practice for some time. Then I started my own practice. For the past 13 years, I am working with my own practice. My dad's practice is separate now. My brother takes care of.
Oh, wow.
So me and my wife, both of us take care of my practice.
My next question for you is, sir, how do you educate the patients about the importance of saving their tooth rather than going for more invasive treatment like extraction?
Usually, I keep doing lots of videos in my place. I keep educating public about dental care, how to take care of your teeth, brushing techniques, all those things. I have lots of videos done on that. Then I go to schools and educate in the schools. And for the patients who come to my clinic, so in initial days, we had this problem of patient coming, pluck out the tooth, remove the tooth.
They'll ask for
I usually tell them only one thing. The fingers for your hand, teeth for your mouth. Both are the same. If there is some problem in your finger, will you get it removed and replace the artificial one, or would you go for
and try to save it?
Save it, yeah. Once you tell that, usually they start thinking and they'll try to go for saving the tooth.
So this fingers thing is very nice. Next question is, sir, how do you stay current with all the advancements going on in the field of dentistry, especially endodontics and conservative dentistry?
Okay. And dentistry, usually we have local IDA. I keep attending the meetings, gatherings and all. Then I keep going to endo conferences. And the best to learn endo as a alumni of this college. We have alumni meets regularly, endo alumni meets. We had it some 2-3 months back also. I go to the department straight in the alumni meet. They have lectures arranged for us. They have training for us in the alumni meet. Saveetha.
But that is a really nice thing.
So even now, even today, if I come here, I can go to college. I can tell in the department 2 days back. All the staff are very friendly. They're lot juniors to me, but they feel me like they're part of them. So I can tell anybody that suppose I want to learn milling. Suppose Manish, I want to learn milling. I tell him one day before. He'll make it ready. I'll speak to Kritika, tell her, doctor, I want to know about the cardiology. She'll make everything ready for me. So alumni has so much of strength here in Saveetha. So updating, there is no other place getting updated than in your college itself.
Experiencing firsthand. My next question for you is, what do you find the most rewarding about being an endodontist?
Rewarding for being an endodontist. Like, as I told you, every patient, you call up the patient the next day. You ask them, do you have pain? I call up I see to that all of my patients are called up the next day.
Okay.
So if they have pain or not. So first thing they say is, sir, very happy.
Wow.
So you can't expect anything more than that. Yes, you can make crowns, you can make bridges, you can make lots of work in dentistry. You will have satisfaction there. But this relieving someone's pain is amazing feeling. You should see the happiness in the patient's face.
Yes,
it's really...
It sounds amazing. So my next question would be, can you discuss a complex case that you had an experience with, and how did you deal with it?
Complex case or problem with complex cases?
Yeah, problem with complex cases.
Complex cases usually every case, every single tooth, every root canal is different. It's different because it's not the same anatomy inside. Once you open the tooth, one teeth will have canals, this kind of canals, one teeth will have different kind of canals. Sometimes a single canal becomes two. Sometimes single canal becomes two and becomes one again.
Yes.
So it's a lot of change and differences. So every case looks different. And there is no such option like making a guide and making this thing also, unless the canal is straight. It's very difficult. Only thing is you can locate the canal with your CVCT, but you can't do the cleaning and shaping with the help of a guide or something for root canal. It's your mind you have to put, your eyes you have to look into it, your heart you have to put into it. So every case looks complicated. Some cases do fail.
Okay.
Some cases do fail. Whatever you do, they do fail. Reasons could be infinite. So how I tell my patients is, I tell them first, I tell them there is problem. There are two options: get it removed or get a retreatment. Then I'll do it for you.
Yes.
So some patients, very few patients are little aggressive. So I ask them, what do you want me to do? Most of them, they'll say, I paid so much. Money, I'll pay you back. No issues. No issues. Forget about money. I'll pay you back because it's failed. The reasons can be infinite.
True.
So I can remove the tooth and give you a new bridge. I'll reduce the cost of it or do it for you at a lesser price. Reduce all that price. If you want, you get it done. Or I'll do retreatment will be usually successful, or episectomy or something like that.
Yes, sir.
First, tell the patient, I'm sorry. I'm ready for that always. When the mistake is on my side, I tell that. Once you tell that, no patient will be aggressive.
That's really humble, sir. That's
and
really
as I told you, every patient, we call them next day, we'll ask them about pain. So we keep following up every patient. So usually there won't be a problem. I think you guys in your clinics also, you should start doing that.
Yes, sir. That's a really compassionate way of treating patients, a holistic approach, I would say. So my next question would be, how do you prioritize comfort and anxiety management during endodontic procedures?
Anxiety, usually I speak to the patient before the treatment. I tell them it's a minor procedure. Only thing, biggest problem we have in dentistry is the syringe needle.
True.
So to comfort that, we give them some topical anesthesia, or sometimes we have this needleless anesthesias, needleless injections. Give that a little, or give a insulin syringe, give a small prick. Still not comfortable, we give them stress nil or some alprazolam 0.25 mg. Rarely we do that.
Okay.
So talking to the patient really helps for the anxiety of the patient. Giving them confidence, telling them it's not a open heart surgery or brain surgery you're doing, you're just treating the tooth. Only thing is, it's a delicate procedure and a carefully done procedure. So you give your time. You tell them that, they'll get confidence.
Next question would be, what techniques or technologies do you commonly use in your practice, and how do they enhance patient care?
Okay, initially, I have to tell you, complex. During year 2000, when I just joined my PG, our HOD, Dr. Lakshmanan. That was the first time these rotary instruments have come into the market. That's the first time. Nickel titanium instruments used in endodontics. That was the first time in India.
Introduced.
Introduced in
Wow.
India. So the inventor of this Pro Taper's previous version, Ben Johnson, was there here.
Yes, sir.
So we went there. We had a lecture there. So Saveetha was the first college to buy all that equipment and bring it to the department.
Oh, wow.
So all other staff, all other teachers, those days you remember, they were all doing with hand filing.
Yes.
Everybody was talking about tactile sensation. You'll miss the tactile sensation if you use this instrument. Here, nothing doing. My HOD said he wants, college is always ready to get whatever new is there. So we got it here. And we practiced from day one with rotary instruments. We worked with them along with hand files, of course.
Yes.
So our final exam we did with rotary instruments. So once I went back to my hometown, there is hardly anybody who was using rotary files. So all my colleagues everywhere, wherever they are in the world, I'm sure they're all successful. The reason is we went out with the latest knowledge and we have been working with those instruments from that time itself. Everybody was doing root canal for hours. We were doing it in 10-15 minutes.
True.
So our style of root canal was totally different. Later on, some 10-15 years back, I started using the loops. They really changed the way I practice. They really changed. You can see a lot more. So you guys are now started using them from your first
Yes,
year.
I'm very
So
blessed.
You will really know the meaning of them, the value of them.
Yes.
Then after that, I have CBCT in my clinic. So that helps a lot in locating some canals. I have to start with the microscope next. So I keep updating myself with newer advancements. As I told you, I keep coming to college, not just because my daughter is here. I keep coming regularly.
Yes, sir.
So I have my friends. So I keep coming to meet them now and then. When I come to Chennai, I come here, go to the department, see what's new is there.
Yeah. What advice would you give to someone who's considering a career in conservative dentistry and endodontics?
Okay, don't think of joining endodontics.
Oh, that's
Listen
very
to
new approach.
me completely.
Yes.